Hi, my name is Dr. Christopher Weber. I'm an internist, pediatrician, and obesity medicine physician. Sure, so I got into the medical field for a lot of the kind of typical reasons, right? I could have my nose in a book all day long, so I like studying, and a lot of being in medicine is time with study. I like to work with people, I wanted to help people, all of that stuff. And just had a special interest in the sciences, but also social studies, so a wide breadth, and I kind of ended up in medicine. The area of medicine that I really get most excited about is weight management and obesity medicine. That is, I think, critical for any primary care provider to be knowledgeable about, but that is prevention. If you can work on weight, preventing weight gain, reducing weight to healthy levels, it prevents all sorts of diseases that we're treating every day as primary care providers. It's really exploding as far as a field. It's relatively new, believe it or not. So I'm certified by the American Board of Obesity Medicine, and as of the most recent numbers I have is 2016, only 2,000 of us in the United States and Canada. So it's a relatively small field. And one reason is that the evidence is just ramping up. So not a lot of study in it traditionally. Tons of study on the complications from weight, the heart disease and diabetes and all of those things, but how you treat the weight itself is relatively new. The medications are relatively new, the last 10 years or so for most of them. But benefit of this being a new field is that there's all sorts of growth and new knowledge and things that really can help people quite a bit. Yeah, so as an obesity medicine specialist, I describe obesity medicine really based on 4 different areas. Clearly the weight is what we're working on, but that's not the only thing. The way we go at it is physical activity, nutrition, that's the diet and exercise that everyone thinks about, behavior and sleep, and then medication, supplements, surgery. So those 4 areas we cover. And like a lot of things in medicine, it's incredibly complicated, right? There's the social setting, there's your genetics, there's your metabolic rate, all sorts of things that play into this. And so we touch on all those things. And then as far as a field, we have dietitians we work with, we have other specialists in different areas. So for example, sleep apnea and weight go together. So we have a sleep medicine specialist we work with. We work with the surgeons and some other specialists, but it's very comprehensive. So we go after all those things. So what I like to do outside of work is mostly family. So I have 3 kids, my wife, so I spend most of my time with them doing the 3 young kid events, so swimming and sports and all of that, and playing at the park, just simple things, but that's, having dinner together, those things. So that's most important for me right now outside of work. Other things, so I try to walk the walk, so I like exercise, so I do a fair amount of that, and I like cooking, love food, so experimenting with food and cooking I enjoy also. A little bit of a guitar here and there.